Assalamualaikum and hi. So today I'll be presenting about white blood cell, which is eosinophils. So the process of producing leukocytes is called leukapheresis. It is the process of formation and maturation of white blood cells. Next, granulocytopoiesis is the formation of the granulites, such as neutrophils, eosinophils, and basophils. So it is stimulated by various colony-stimulating factors (CSFs), which are hormones produced by mature white blood cells. So granulocytes maturation is divided into 6 stages, which we can see as in this slide. There are 6 stages of it. So actually, the process starts from leukocytes, which originate from hemocytoblasts. Hemocytoblasts will then differentiate into myeloid stem cells and also lymphoid stem cells, but in this case, it is myeloid stem cells. So starting from that myeloid stem cells, it becomes myoblasts, as seen in these first stages in this slide. So from then, it will become promyelocyte, and then the third one, eosinophilic myelocyte, the fourth one, eosinophilic metamyelocyte, the fifth one, eosinophilic stem cell, and then the last one is now it becomes eosinophil. When it's mature, it will become eosinophil. So, okay, during this process, which is granulocytopoiesis, there are of course structural changes in which will include all of this as in stated in this slide. So the first one is it will become decrease in cell size, as we can see from this slide before, and then there will be changes in nuclear shape, because as we can see, eosinophil have a different shape of its nucleus. And then the third one, condensation of nuclear chromatin. And then the last one is an accumulation of cytoplasmic granule, which, as we can see, eosinophil, or as we know, eosinophil has a granule. So I think that's all. Thank you.
As for structure of eosinophil, as you can see here, it has a large specific granules, which makes it more distinguishable than other granulocytes. It consists of a dense crystalline core and a matrix surrounded by a membrane. It contains a large number of mediators, which makes it capable of inducing inflammation. Next, the primary granules over here, it is much more smaller than specific granule. It is the principal location of charcoal-laden crystal protein or galactin-10. The protein have been identified in tissues subject to eosinophilic inflammation. For lipid bodies, the lipid bodies are particularly important when considering the role of eosinophils in asthma. It is a key site of arachidonic acid acidification and eicosanoid production due to the high concentrations of relevant enzymes. Eosinophils also express receptors for multiple other cytokines and growth factors, cytokine over here, and then including for interleukin-4, interleukin-13, interleukin-33, thymic stromal lymphopoietin, and transforming growth factor beta. Eosinophils also possess cell surface receptors for lipid mediators over here, such as leukotrienes, prostaglandins, and platelet activating factor, all of which have been shown to have a role in asthma pathophysiology. Fc receptor are expressed on the surface of eosinophils, which functions to IgA and IgD, IgE, IgG, and IgM. It functions as facilitating interaction with the adaptive immune system. As for MHC2 molecules, eosinophils have an additional role as antigen-presenting cells. It facilitated by the presence of MHC2 molecules and stimulatory molecules. For addition receptors, it has 4 types, but mainly on eosinophils, the integrins and selectins are the main forms. It allows cells such as the eosinophils to adhere to the extracellular matrix and to other cells. For Siglec 8, Siglic 8, is a sialic acid immunoglobulin like lectin, a carbohydrate binding protein expressed by eosinophils, mast cells, and basophils. It represents a potential therapeutic target for eosinophil-mediated disease. Thank you.
Assalamualaikum. I'm Muhammad Daniel Hakim bin Zaki will present about functions and mechanism of action of eosinophils. So there are three main functions of eosinophils. The first one is plasma cell survival, and the second one antiparasitic and bactericidal activity, and the last one eosinophils participate in immediate allergic reactions. So how do eosinophils work in our body? So for plasma cell survival, eosinophils promote plasma cell survival to regulate the balance between T helper and also T regulatory responses in various organs such as guts and lungs. And also eosinophils regulate the glucose tolerance within adipose tissues and produce several different types of growth factors which will contribute in tissue repairing. So for antiparasitic and bactericidal activity, eosinophils consume foreign substances which they fight substances related to parasitic infections that have been flagged for destruction by immune system. And the last one, eosinophils participate in immediate allergic reactions. So, platelets help white blood cells to sense and communicate with inflammatory stimuli. The interactions between eosinophil platelets occur via certain surface cell receptors, which then will promote activation of the bound platelets and endothelial cells. This will then activate long-term inflammatory reactions. Thank you.
Absolute eosinophil count test is a blood test done to measure the number of eosinophils in the blood to determine some medical conditions. Less than 500 cells per microliter indicates the normal eosinophil counts. So, how is eosinophil count test done? First, blood sample collection is taken from the patient either by phlebotomy or known as venipuncture or by capillary puncture. An adequate amount of blood is taken by these two methods using the proper techniques to prevent unnecessary risk of exposure to blood and to reduce adverse events for patient. Next is blood smear. It is done by putting a small drop of blood about 1 centimeter from one end in the center line of the slide. Then, the blood is spread immediately and quickly along the slide at the angle of about 30 to 45 degrees. After that, sample is labeled with the date and patient's name, and the blood smear is allowed to air dry completely. The next two steps are fixation and staining. The best choice for fixation is by using methyl alcohol. Fixation is a must as soon as blood smear to protect the cell's morphology. Romanowski stains are used to routinely stain blood films. Stains contain basic dye which has affinity for acidic components of cells, that is nucleus, and acidic dye which has affinity for basic components of cells, that is cytoplasm. As the result, by looking under microscope, eosinophils will appear as orange-red granules with 2 to 3 nucleus loops connected by thin strands. Then the number of eosinophils present per 100 cells is counted. The percentage of eosinophils is multiplied by the white blood cells count to give the absolute eosinophil count. Eosinophilia is a condition where the eosinophil count is more than 500 cells per microliter. This condition more often indicates a parasitic infection, an allergy reaction, or cancer.
Hey, I'm going to talk about eosinophilic disorder. There are three main highlights in eosinophilic disorder, which is low number of eosinophil, high number of eosinophil, and hypereosinophilic syndrome. A low number of eosinophils in the blood can occur with Cushing syndrome, bloodstream infections, and treatment with corticosteroid. However, a low number of eosinophils does not usually cause problems because other parts of immune system compensate adequately. A low number of eosinophils is usually detected by chance when a complete blood count is done for other reasons. Treatment of the cause restores the normal number of eosinophils. The most common causes of a high number of eosinophils, called eosinophilia or hypereosinophilia, are allergic disorders, infections by parasites, and certain cancers. If the number of eosinophils is only slightly elevated, people usually do not have symptoms, and the high number of eosinophils in the blood only discovered when a complete blood count is done for other reasons. However, sometimes, particularly when the number of eosinophils is very high, the increased number of eosinophils inflame tissues and cause organ damage. The heart, lungs, skin, and nervous system are most often affected, but any organ can also be damaged. Symptoms are related to the organ affected. For example, people may have rash when skin is affected, wheezing and shortness of breath when lungs are affected, shortness of breath and fatigue when the heart is affected, or throat and stomach pain when the esophagus or stomach is affected. Accordingly, eosinophilic disorders are diagnosed according to the location where the levels of eosinophilics are elevated. For the example, eosinophilic pneumonia, eosinophilic cardiomyopathy, eosinophilic esophagitis, eosinophilic gastritis, eosinophilic enteritis, and eosinophilic colitis. Hypereosinophilic syndrome is an uncommon disorder in which the number of eosinophils increase to more than 1,500 cells per microliter of blood for more than 6 months without an obvious cause. Some people have a rare chromosome disease. People of any age can develop hypereosinophilic syndrome, but it is more common in men older than 50. The increase of eosinophilics can damage the heart, lungs, liver, skin, and nervous system. Symptoms may include weight loss, fevers, night sweats, fatigue, cough, chest pain, swelling, stomachache, rash, pain, weakness, confusion, and coma. Additional symptoms of this syndrome depend on which organs are damaged. Without treatment, generally more than 80% of the people who have this syndrome die within 2 years, but with treatment, more than 80% survive. Heart damage is the principal cause of the death. For the conclusion, eosinophils is formed from leukapheresis, which is a process of formation and maturation of white blood cells. Eosinophil contain about 2 to 3 loops connected by thin strand with orange to pink granules in its cytoplasm. Eosinophil is important for anti-allergic role and defense against parasitic infections. Eosinophil count test is blood test to measure the number of eosinophil in the blood. Eosinophilic disorder is caused by any abnormal condition of eosinophil.